First and foremost, if you talk about these foam-based dressings, the number one complaint with them in the clinical setting is patient pain. When we put these foam dressings directly onto tissue, the tissue basically over time grows up into the foam, okay? And that is one of the reasons why that dressing frequency gets so much attention, because the longer they let the dressing stay on there, potentially the more the tissue grows into the foam. And so what happens later is they come back to remove that dressing and it's stuck. It's going to pull that tissue out. Now, some vendors have tried to make lemonade out of lemons there and say that that's a nice form of debridement, which it is. But, you know, truthfully speaking, in debridement, we want to choose what gets taken out and what stays, not the dressing, okay? So pain is a key component to that, and one of the biggest complaints about them. So when we put the LipoGel down, aside from the biofilm aspects that we've already discussed, it does not prevent the foam from touching the tissue bed. The LipoGel will move into the foam just a little bit. It does not go all the way through the foam. It's going to stay right there interfaced with the tissue, but it effectively takes a little bit of a protective film there that is it's actually a dynamic film. The gel actually literally moves, okay, during therapy. But the point is it helps inhibit tissue from growing up into that foam. So not only they're initially put down on therapy with a little bit of a gel cushion, over time that gel inhibits tissue from growing up, or I should say as the therapy progresses over time. It inhibits the tissue from growing up into that foam. So when they change the dressing, it's a lot less painful for the patient. So number one advantage or rationale is patient pain. There's a lot of national exposure on patient pain and a lot of drivers in medicine to look at ways to reducing that. So, you know, that was a key component to that. And then the other aspect is simply to provide an anti-biofilm component to negative pressure, all right? And that's just done with base LipoGel. Once we go into the DNA analysis and the DNA-specific negative pressure kits, now we're talking about DNA-guided personalized medicine with negative pressure. With an antibiotic offense, you're not talking about just a silver, you know, foam. You've got talking about using highly concentrated antibiotics right there in the wound bed, specific to that patient's microbial census. And that's pretty powerful.